Good afternoon, everyone, and I'd like to welcome you and call to order our Middlesex County Council meeting for Tuesday, October the 10th. I would like to acknowledge that I am an ally to Indigenous peoples. We acknowledge that the land we stand upon today is the traditional territory of the Attawandaron, Anishinaabe, Haudenosaunee, and Lenape-Wauk peoples, who have long-standing relationships to the land, water, and region of southwestern Ontario. The local First Nation communities of this area include Chippewa of the Thames First Nation, Oneida Nation of the Thames First Nation, and Munsee Delaware Nation. We acknowledge the growing urban Indigenous communities in our area. We acknowledge the treaties that are specific to this area. Treaty 2, the McKee Purchase. Treaty 3, Between the Lakes Purchase. Treaty 6, London Township Purchase, Treaty 21, Longwoods Purchase, Treaty 29, Huron Tract Purchase. We value the significant contributions, both in the past and present, of local and regional First Nations of Turtle Island. We acknowledge historic and ongoing injustices that our Indigenous peoples endure in Canada, and we affirm our commitment to honoring Indigenous voices, nations, and cultures, and to moving forward in a spirit of reconciliation and respect. Since our last meeting, I was able to join Chief Neil Roberts and a number of our paramedics at a service or a dinner, gala, whatever you want to call it, in Collingwood, where a number of our paramedics were honored with the EMS Exemplary Services Medal from the Governor General. This recognition should not be confused with a long service award, although a long service of employment and to the profession is required. This award recognizes professionals who have performed their duties in an exemplary manner, characterized by good conduct, industry, and efficiency. Recipients have completed 20 years of exemplary service, including at least 10 years in the performance of duties that involve potential risk. It was an honor to be with these incredible paramedics and to see them recognized in such a way. Recognized for a career of exemplary service from MLPS were paramedics Mark Weiss, William Seeley, Robert McCoy, Rick West, Jeff Weir, Simon Martin, and Deputy Superintendents Tracy Gosling and Steve Mormon. Later this fall, paramedic Robert Gordon and our very own Chief, Neil Roberts, will be recognized for 40 years of careers dedicated to service and good conduct. For more on why these paramedics were recognized, there is a media briefing on the website, and I would encourage you to take a few minutes to read more about what these professionals not only add to their careers, but personally as well. We really are well serviced by these employees. Today is October 10th, and so I must also recognize that it is World Mental Health Day. The overall objective of World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. This year's theme is Mental Health is a Universal Human Right. Our mental health is as important, if not more important, than our physical health. And we must talk about looking after that, just as we do when we talk about how to improve and maintain our physical health. As we have shared so many times, there are resources out there. So if you or someone you know and love is struggling with mental health challenges and/or addiction, help is available. 1-833-456-4566 is a number that should be plugged into each and every phone. It is the mental health crisis support line and can be reached 24 hours, 7 days a week. Locally, you can access resources through CMHA's Reach Out program at 519-433-2023 or visit www.reachout247.ca or contact through email at info@reachout247.ca. Is there any disclosure of pecuniary interest? Okay, seeing none. The agenda is in front of us, and I would ask for a mover and a seconder to approve the agenda as presented. Councillor Mayhew and Councillor Grantham. All in favor? And that is carried. We have one set of minutes in front of us, and that is from September 26th. And if there doesn't need to be anything amended on that, I would ask for a mover and a seconder to approve those minutes as presented, and that the recommendations of the Committee of Whole be adopted. Councillor McGuire and a seconder, please. Councillor Clark. All in favor? And that is carried. We have one action item in front of us, and that is with regards to our 2023 inaugural meeting. And at this time, I'll pass it over to our clerk, Paul Shipway, to walk us through that.
Thank you, Madam Warden. Through you, the procedural bylaw requires a report come to council to set the inaugural meeting date. The meeting date was tentatively set previously with the council schedule. Given the involvement from the county and the FCM Women in Local Leadership Program, we're recommending that be altered to accommodate the next trip. And one other item I'd like to point out is section 6.3A of the procedural bylaw requires members of council to give notice of their intent to run for warden. If this report is approved and the date is set, the date that would have to be done by is November 7th, 2023, as part of the long-term service reception.
Okay, thank you for that, Paul. Any questions or comments on the report in front of you? Okay, then I would ask for a mover and a seconder for the recommended motion that is in front of you. Councillor Brennan and Councillor McGuire. All in favor? And that's carried. Thank you very much. Any inquiries? Any notices of motion? Councillor comments or other business? Okay, then I would ask for a mover and a seconder to move us into the Committee of the Whole at 7 minutes after 1. Councillor Grantham and a seconder, Councillor DeVitt. All in favor? And that's carried. We do have a delegation with us this afternoon, and it's my pleasure to welcome to the podium Emily Williams, who is the Chief Executive Officer of the Middlesex London Health Unit. And at this time, Emily, welcome, and I'll turn it over to you.
Thank you, Madam Warden, and thank you very much through you for having me today and for your consideration of the requests before you. The financial situation for the Middlesex London Health Unit has been evolving over the last several years as we've come out of the COVID-19 pandemic and resume full programming operationally. The request before you relates to our 2022 financial year end, where we posted a surplus just over $2 million. And that was, again, largely because in 2022, our staff remained redeployed to COVID work, and we did not have all of our programs functioning. The county portion of that, using our cost shared funding formula, 75%, 25% provincial and municipal, the 25% then gets broken down further between the City of London and the County of Middlesex. And the portion for the county is $80,000, just over $80,000. One of the pressures facing the health unit coming into 2024 at this point in time, given our inflationary pressures, which we know are not unique just to us, we are facing an organizational shortfall for our budget in 2024 between $2.6 and $2.8 million. Historically, when the health unit moved from the 50 King location to City Plaza location, they did, after exhausting their resource funds, take out a loan. It's two parts. One is a fixed portion and the other is a variable portion, which is subject to interest rates. Again, not common or unique to us. The rising inflationary rates have put significant pressure on that variable portion of the bank loan. And as such, we are asking permission to redirect the municipal portion of the surplus to pay down that variable portion of the bank loan. We are making a similar request to the City of London at their Corporate Services Committee in the coming weeks. I'm happy to take any questions.
Okay, great. Thank you for that. Questions or comments from council? Councillor Clark.
Through the warden, to Emily, thank you for that report. I noticed in your comments that you're talking about you held the recruitment of several vacant positions in 2023 to balance the budget. So are you anticipating that you won't fill those positions in 2024? And if you are, how does that impact the operation of the organization?
Thank you. And through the warden, we are looking at permanent reductions in our staffing in the upcoming year. That has been communicated to both our board as well as our staff. We are in the process of working through those decisions in terms of what programs and services will be impacted. Those decisions are not yet finalized, but anticipated to go to the Board of Health for November of this year. But we are facing significant reductions based on that $2.6 to $2.8 million shortfall.
Thank you. Just as a follow-up question, how does that impact operations? Are you able to deliver the same level of service, or maybe just speak to that in general?
Yep. Thank you for the question. And through the warden, no, we anticipate needing to stop certain programs and services. At the September Board of Health meeting, Dr. Alex Summers, our medical officer of health, provided a strategic prioritization framework for how we would be going through making those decisions, largely focusing on our legislative mandate, services that, of course, are critical. Similarly, taking lessons learned through the COVID-19 pandemic of what services did we need to maintain despite a pandemic, those would be prioritized. Additionally, work related to COVID-19, so our vaccine preventable disease program, as well as our infectious disease staff, we will need to invest in positions there, as the ministry has indicated that COVID-19 is what we call a disease of public health significance that we will need to maintain staffing and resources around. But unfortunately, at this point in time, there is no plan to offer additional funding in order to keep those programs running. In terms of our funding from the ministry at this point, the Minister of Health announced a 1% increase for the next 3 years at the Association of Municipalities of Ontario meeting this summer, as well as the continuation of the mitigation funding. Unfortunately, that 1% is insufficient to address the inflationary pressures that we're facing, with 2% for staffing and roughly 3.9 to 4% for corporate expenses.
Okay, thank you.
Any other questions or comments from council? I just have one, and I don't know who wants to take it, if this is a Cindy question or an Emily question, but I do know from the County of Middlesex standpoint, there was an outstanding bill, I guess for lack of a better word, that had been sent to the health unit with regards to the moving costs when 50 King was vacated. And I'm just wondering where that stands, and has it been paid for, or is it still outstanding?
Through the chair, I could start with that, and Ms. Howard could chime in if she wants. Cindy and I are in regular conversation about that. It has not yet been resolved. We are hoping for within year, by the end of the year, to have that situation, that invoice resolved.
And how long has that been outstanding since?
Through the warden to council. Sorry, I just had to look at my backup documents. Since 2020 that the bill's been outstanding since.
And what would the holdup be on that one? Why is there still negotiation going on?
Through the warden, the last conversation I had with the Board of Health was in camera, and I think would be inappropriate to comment in public session further at this time.
Okay, thanks. Right, any further discussion, Councillor Grantham?
Thank you, Warden. Through you to Emily, just a question. I like that word disinvestment. Is this the first time that you've ever had to disinvest or cut programs?
Through the warden, the health unit has historically used a an approach to budgeting called program budgeting marginal analysis, led by teams within the health unit where they would come up with their own ideas for disinvestment based on priorities within the program. So the health unit's been doing that for years, where they've been disinvesting a specific position to invest in another program or service. This year is a bit different because the amount that we're facing is actually requiring us at the strategic level, at the program and team level, to decide what programs and services we're going to stop doing, which has impact for more than just a marginal position here and there.
Okay. No follow-up, Councillor Grantham? Okay. Anything else? Okay, you do have a recommended motion in front of you, and I would ask for a mover and a seconder on that, please. Councillor McGuire and Councillor Smybert. All in favor? And that's carried. Thank you very much, Emily. Just before you go, a couple things. One, I'm glad that you got through this without having any visitors join us, like the last time you guys were here. And second of all, just a reminder, I did see a notice in the paper about COVID vaccines, and I believe that there still is a clinic that is open in the City of London. And would you take just this opportunity to give a PSA for anybody that might want to take advantage of getting a vaccine or a booster?
Thank you, Madam Warden, for the opportunity. Certainly, our Western Fair Clinic is operational, and I will say we had 4,500 appointments booked. Right now, the vaccine is available to high-risk individuals only, but once that opens up from a criteria place, we will be advertising widely to come and get your COVID and flu vaccine. As well, we will be again offering mobile clinics, and I know that we already have one booked out at the Caradoc Center, where we ran the one mass vaccination clinic. So moving on the mobile strategy as well. Thank you.
Great. Thanks very much. Okay, moving on to reports from our officers. The first one up is from Dirk, and this is with regards to the Southwest Middlesex Official Plan Amendment 3. Dirk, I'll turn it over to you.
Thank you. And through the warden, as we work, as you know from previous meetings, we had a number of these official plan updates that were held up by the provincial review of the county's official plan. So we're working our way through these. This is Southwest Middlesex's OP update. And I would just maybe point out there is one contrast in this report compared to the other ones in that the municipality did not undertake a municipal comprehensive review to expand settlement areas. Early in the process, it was identified that sufficient lands were already designated for growth. So this is a scaled back official plan amendment. And for that reason, the county has not received particular correspondence from the public or from developers, and there was probably less local interest in this project, unfortunately, sometimes. And in the end, though, it does, the official plan amendment would update Southwest Middlesex's OP to reflect the provincial policy statement, the county's official plan, through modification as approved by the province, and includes things like active transportation, additional residential units, minimum distance separation, number of those matters. As I said, this process was held up locally, or the approval of this was held up a bit by the provincial review. We did do an agency and ministry circulation, and we did not receive a lot of comments on it, although there were some from the conservation authorities, Chippewa, the Thames First Nation, the Kettle and Stony Point First Nation, and the modifications that are attached to my report that I'm recommending do address those matters in my view. My report reviews the provincial policy statement and the county's official plan, the outlines at a high level, the modifications that are proposed, and based on all of that, I am recommending approval. I do believe it's consistent, subject to the modifications with the provincial policy statement, and will reflect the county's official plan. Happy to answer any questions.
Okay, thank you very much for that, Dirk. Any questions or comments on the report in front of you? Okay, then I would ask for a mover and a seconder for the recommended motion that's in front of you. Councillor DeVitt and Councillor Grantham. All in favor? And that's carried. Okay, Cindy, budget variance report for August of 2023.
Great, thanks. Through the warden to council. The budget variance report captures expenditures up to August 2023. Each department head has reviewed the report and provided their input. It is expected at this time that all departments should meet budget by year end. However, this could change based on timing of expenses, impacts of inflation, delays with supply chain, and unexpected events. For examples, risks include outbreaks at the home, winter weather conditions, and pressures on land ambulance, including things like offload delays and the increase in call volumes. COVID funding has been winding down, but there has been some permanent programming in place with funding. So for example, we have the PSW wage enhancement program and the increase in the direct care hours at the home. In social services, the expenditures are higher due to an increase in the homelessness funding that we received and funding for the childcare, the National Childcare Strategy, QUILC, as I call it. These programs, though, are 100% funded from the province. The expenditure report for September will include the budget projections. So I'm sure that we'll have a lot more questions when that one comes forward at the end of this month. And I'm happy to answer any questions or the directors that are here as well. Thanks.
Okay, thank you, Cindy. Questions or comments? Councillor Grantham.
Thank you, Warden, through you. I'm not sure who would like to answer it. Under the ambulance, the second paragraph, I just have a question regarding the impacts, staffing and budget from occupation and non-occupational absences. Wonder if someone could elaborate what those are and what the impacts are.
Okay. Who wants to take that?
Well, I can start. I mean, I've been telling council for a while that the system is under stress from all angles. And those of you that are on the authority board understand that acutely. And that starts to show up in the types of statistics that Councillor Grantham's mentioning. Maybe Neil, you can go into some greater detail about specifically where we're seeing some of those challenges around absences.
Through you, Madam Warden, to the councillor. So we are seeing an increase in mental health that is occupational related and non-occupational related, especially coming out of COVID. We started seeing the trend during COVID, and certainly as our call volume increases, so do the incidents of traumatic stress that is seen by our paramedics on the front line. And with respect to Bill 163, which is the presumptive legislation for paramedics on PTSD, anytime a paramedic files a claim, the claim is treated as presumptive and the employee is treated as such and provided care by WSIB. So certainly we're seeing a rise as other healthcare providers are seeing a rise in mental health, but certainly with occupational and non-occupational mental health issues.
Thank you, Warden.
Okay. Any other questions or comments on the variance report that's in front of you? Okay, then I would ask for a mover and a seconder for the motion in front of you to receive that report for information, please. Councillor Smybert and Councillor Mayhew. All in favor? And that's carried. On to correspondence and information items. General payables from September 2nd to September 28th, totaling $675,771.12. ITS payables from September 2nd to September 28th, totaling $100,972.14. Library payables from September 2nd to September 28th, totaling $245,997.88. MLPS payables September 2nd to September 28th, totaling $688,330.39. Planning payables from September 2nd to September 28th, totaling $1,700.63. Roads payables from September 2nd to September 28th, totaling $5,798,421.90. Social service payables from September 2nd to September 28th, totaling $2,107,128.69. Economic Development payables from September 2nd to September 28th, totaling $15,630.68. Strathmere Lodge payables from September 2nd to September 28th, totaling $172,033.75. Can I get a mover and a seconder to receive those items for information, please? Councillor Clark and Councillor McMillan. All in favor? And that's carried. Thank you. On to some correspondence received, TVDSB correspondence for interim accommodation measure enacted on Delaware Central Public School. Changes to the definition of an affordable residential unit in the Development Charges Act 1997. Councillor DeVitt.
Just a comment through Warden to Council. I just wanted to say that it was really welcome to see that there's an income-based measure added to definitions that were vague, I thought, and not operational. So one step at a time.
That's right. One step at a time with this government. Okay, Board of Health update for September 23. And the minutes of the September 26th meeting of the Library Board. Okay, can I get a mover and a seconder to receive those for information, please? Councillor Rock and Councillor Smybert. All in favor? And that's carried. Okay, if I can get a mover and a seconder to have the Committee of the Whole rise at 1:26 p.m. Councillor McGuire and Councillor DeVitt. All in favor? And that's carried. Bylaws. Do you want to take a big breath for this? Because this is going to take a while.
Thank you, Madam Warden. Confirming bylaw 7253.
Thank you. A mover and a seconder for the first and second reading, please. Councillor Clark and Councillor McGuire. All in favor? And that's carried. And for the third and final reading, a mover and a seconder, please. Councillor Smybert and Councillor Brennan. All in favor? And that's carried. You've got the dates of the next meetings in front of you. And a reminder that the Warden's Banquet is Saturday, November the 18th. And I believe invitations will be coming out for that shortly. With that in mind, I would ask for a mover and a seconder to adjourn us at 1:27 p.m. please. Councillor Clark and Councillor Smybert. All in favor? And that's carried.